All right, everybody, welcome back to Emergency Minute. This is episode 28, and I know what you're thinking. 28 episodes? That means I've listened to this idiot ramble on for 27 episodes before this. I digress, and I hear you, feel you. But how about that last episode with Dr. Glaucom Fleckham? That was a lot of fun. If you haven't checked it out yet, do me a favor, stand up, slap yourself in the face, and then return to listening to the show because you missed a dandy. Now, you can check us out on YouTube if you like the video podcast form, or if you're still old school, like the audio podcast available on Spotify, Apple, or wherever else you get your podcast. Now, today's guest is Dr. Diana Moore, and you may know her more as DrMSmiles on social media. She is a dentist, a mom of two. She grew up in Denver, Colorado, got her college degree, master's, dental school, residency, all of the above at University of Colorado. Go Buffaloes! Moved to Amarillo, Texas about 7 years ago for a great job opportunity. She loves spending free time with her two kiddos, traveling, and pretending to be cool on TikTok. I think she's pretty cool. So without further ado, here is Dr. Diana Moore, aka DrMSmiles. Welcome to the show. Welcome to Emergency Minute. We're very excited to have you.
Thanks so much for having me. I'm so excited to talk to you.
Yeah, so I love following your content on TikTok and social media, and I think everyone should follow you as well because
Thank you.
You definitely make me laugh, and I think sometimes it's hard to make healthcare funny at times, especially in dentistry. But I love the intersection here of the emergency medical side that we have, and now dentistry as well.
Yeah, totally.
And I wanted to see if you had any cases in mind where like that, sort of intersection happened. Is there anything that you've come across in your career?
All the time. I mean, a lot of our patients will seek emergency care at the emergency room for a dental infection. You've seen it a number of times, I'm sure. And, we have patients that sometimes they don't realize that we're on call, certainly, and can take calls and see them over the weekend. So, they're used to being able to go to the emergency room and be treated, and that's totally fine. But I feel like in my experience, a lot of emergency medicine physicians and staff are not as familiar with dental problems, let's say, and just intraoral anatomy and maybe not even feel so comfortable treating them. So a lot of times, and this is perfectly fine, and I applaud the emergency medicine doctors for doing this, is treat an infection, an acute infection with a course of antibiotics, and then tell them to go back to their dentist. And I know, emergency room physicians know this, but a lot of patients don't realize, they go on antibiotics and think, okay, well, now it's going to go away, right? And you definitely have to go back to your dentist because definitive treatment for an oral dental infection has to be treated with, a root canal or an extraction most of the time. So antibiotics will really just kind of hush it for a little bit, and it'll definitely come back. So we see that a lot. And yeah, it's just that's where we intersect a lot. And I did a residency in oral surgery where I worked in the hospital and had to be on call to go in, and mainly it was dental infections, and so
right.
Working with emergency room staff is always a pleasure, and y'all are just the heroes, and help us so much, and we thank you for that. So yeah.
Well, I appreciate it. And I just had a case this week. Well, I had two cases this week. I thought it was ironic because I knew we were having this upcoming podcast.
Yeah, sure.
But one was like a young girl, like, 3 or 4 or 5 years old that like fell and like, of course, got her two front teeth kind of like jammed up inside of her gums.
Yes.
And they're pretty loose and everything. And of course, parents are freaking out and they're like, what are we going to do? What are we going to do? And
yeah.
So we get that. And, from our standpoint, it's really we really don't do a whole heck of a lot in that scenario. And
sure,
I usually just tell family that if they fall out, like just enjoy the laugh when you look at the photos, the family photos years later. So
yes, well, I mean, baby teeth can't be reimplanted, but adult teeth
right.
Yeah, you need that. Yeah, it's something that I get a lot from patients too. Like, oh, should I know that I'm supposed to put their tooth back in? It's, well, baby teeth, we just let it. Yeah, be a good family picture for later on.
Exactly.
What to say?
Like, I remember that one time. Yeah, little Susie, and she had no teeth because she got them knocked out or whatever.
Yeah, well, kids lead with their head too. So
right, for sure. They're definitely a little top heavy in that regard. So, but the other case was a patient that actually I don't remember the exact mechanism, but they had basically blown up their tooth. and so they brought it like in like a little sandwich baggie, and it was in like 5 different pieces.
Mm,
And I'm like, oh, okay.
what
What
do
do
you
you
want
want
me
me
to
to
do
do with this? Like,
here?
did you
Super
bring
glue.
super glue? Like,
Yeah.
I was like,
I know. I get that too. I mean, I've only maybe one time been able to take a piece of a tooth that broke and then like, bond it back because it was
mm,
a clean cut perfect, but usually we just restore it with like restorative material. So,
that's funny. Yeah, yeah.
yeah.
So what? I mean, obviously, everybody, well, you got to brush your teeth and you got to floss and stuff. Any other tips or tricks that you have to like stay out of a dental emergency, or like just to stay on top of your dental care?
I mean, yeah, the preventative aspect is huge. And I'll be honest, I mean, I was, in my early 20s when I was in dental school for the first time realizing how you really do appropriately need to brush your teeth. And 2 minutes, and hardly anybody does 2 minutes because it's something in passing you do in the mornings and in the evenings to get to bed or get to work, whatever. But truly, it does need to be 2 minutes, and flossing once a day if you can. That's one thing I will say is really great about an electric toothbrush is it has a timer on it. So it'll get
Right.
you brushing for 2 minutes for sure, because it'll let you know, where when to move quadrants in the mouth and then when to be done. So yeah, I mean, prevention is huge for sure. Another thing, I mean, this is kind of like a sidebar in a sense, but there are some things that, a lot of people don't know about, certain medications and even medical therapies that they have done that then affect the jawbone. You probably know about like bisphosphonate induced osteonecrosis of the jaw. And a lot of patients don't, they'll get treated for osteoporosis or even, types of cancers that spread through the bone. And these bisphosphonates are fantastic quality of life drug therapies, but they can cause catastrophic problems during oral surgery because of those osteoclasts being inhibited. We can't have that bone turnover healing process happen. And so we end up with patients a lot of times coming to us and they have these horrific, dead bone and then furthermore osteomyelitis from that we have to resect, and it's a mess. So that's one thing
Yeah.
I throw out there, that the older populations, if they are on those bisphosphonates, it's something to look out for. So yeah, but like, I
Yeah.
mean, like we kind of alluded to, that really truly prevention as far as dental decay and dental gum disease. So yeah.
Yeah, and a lot of times when these patients come to the ER, unfortunately, that time period of prevention is long gone.
Yes, yes,
And I'm
yes.
sure you see way worse than I do, but some of the stuff we see in the ER is like, man, I'm not sure how I can help you. I'm gonna do my best,
Yes.
but
Yeah, sure, sure.
we try to build good habits. Like with our kids, we have like these timers. You like flip them,
Good.
and I remember the first time like I was doing this with the kids. I'm like, man, that is a long time.
I
Like I'm
know. Yeah.
probably not doing it as long as I should be.
Same, same. And like I said, it was until I was in school that I realized that we really shouldn't be doing that. So, and 2 minutes is a long time when you don't really want to be doing something. So,
Yeah. So I guess one thing I wanted to ask you, since obviously I'm an emergency medicine physician, is like, what should somebody do if they have a dental emergency? Like I've often wondered this myself because I know the limitations of the ER. Like I know my dentist's like personal cell phone, but that's because he's like my neighbor. So like
oh
like
yeah, yeah,
what do
sure.
you like? What should the average Joe do in a situation like that?
I mean, so, it depends on the emergency. Obviously, if it's some sort of trauma, call your dentist right away. A lot of dentists will have an after hours number, and then be able to guide you into what to do. Certainly, if they can see you. If it's a true dental emergency, they'll see you a lot of times. But if it's something where you're starting it, because a lot of times, I mean, a dental infection will start off as kind of an ache, a little something that, maybe it'll go away.
Right.
And it does a lot of times because you have the process of a nerve becoming inflamed and then it becomes necrotic. So there's this, these waves that'll happen a lot of times. And so I would say, if anything, if you do start to feel something funny, try to get to your dentist as soon as you can, because the sooner the better, really, as far as, the restorability of a tooth, or even, if it becomes a pretty nasty dental infection, of course it can become potentially life threatening. So, anything that I can recommend to get somewhere sooner rather than later is always good. But again, realizing that a lot of dental offices, if you do have a regular dentist, will have an after hours number. And, okay, I chipped a front tooth. Your dentist may not come in to see you on a Saturday at, 9:30 p.m. because you were at the bar and you were talking when you should have been listening, type of thing.
Minding your own business. Yeah.
So, I mean, but if it's a true dental emergency, me personally, I would come in to see a patient. So, keep that in mind.
Yeah, and to your point, about the dental infection becoming an emergency, I remember I had a case once where this patient had sepsis, and he was like young and healthy, and I'm like, what am I missing? I'm like, chest X-rays clear, there's no pneumonia, there's a white count, so I know there's probably an infection somewhere. The urine's clear,
Yeah.
and I just remember, and he ended up getting worse and worse, and it turned out, and I remember this, and I'll never forget this case, that he had bacteremia, basically sepsis, from like a bad dental infection that he just never like volunteered to me. And, he ended up having like a really bad outcome. And I'll never forget that case because it was a great learning case. It was like 20 years ago. It was very early in my career. And so now it's definitely something that I ask, like, especially if I have someone who's septic and I'm like, I can't find a source. Like, have you had recent dental pain and, dental problems? Because sometimes it can be a little bit silent and then it can be deadly. So.
Well, even asking them if they've had dental work too, because sometimes, especially oral surgery, even a root canal, something like, more invasive, it definitely, you can have these post-op infections develop, and, the perfect storm, if you will, of somebody with, comorbidities and certain diabetes and stuff like that. They're kind of set up a lot of times to have those infections blow up, and then they can become horrific, as you know. So, yeah.
Yeah, for sure.
Absolutely. Yeah.
So I wanted to pivot a little bit from some of the like how to and like where our worlds collide. In a different area where our worlds collide, is unfortunately some of the burnout, some of the bad things that we see, like some pretty unpopular topics, suicide, mortality rates, just things like that between dentistry and emergency medicine. And I guess I just wanted to hear your input as to why do you think that is in your field?
It's something that you don't think about when you get into it, but the, patients sort of, when they come to see us, a lot of times, in both cases, they're on their worst day, and I don't know, can I swear just a little bit on here? Tiny
sure.
bit?
Yeah,
okay.
It's okay.
So,
I'll just notify my mom in advance. So.
Okay. So, I mean, if you have like a regular asshole, if they're in pain, they're going to become a colossal asshole, right? So they're not going to be very, very nice to you. And really, to me in the beginning of my career, I'm of course going to have taken that personally, and you grow thicker skin as you get older. So initially, the sadness, if you are a burnout, may become from just feeling patients aren't very grateful and kind of bring you down. But then when it becomes later on, it's more, it's a physical job too. So I don't know about you, but yeah, you kind of really do have to stay fit. So that's my biggest thing, honestly. If I can say anything as far as the physical and mental intersection really there is staying fit, and for me, keeping my core as strong as I can, that's going to help prevent these aches and pains that then can lead to mental depression and bad depression, certainly. So for me, it's just later on in the career, it's more that physical drudgery. Once you get to a Friday, you're just kind of, I'm tired. I've kind of lost some sleep over the last few days, and I'm sure you can have some really good input there, because your schedule as an emergency room physician is probably not consistent, or maybe later on in your career it probably is more, but I can imagine your sleep schedule isn't very consistent and healthy sometimes. So
yeah, they just came out with a recent report that the average lifespan of an EM physician is 58 years old, which is the lowest of like any healthcare profession. And yeah, I think some of that's probably, I know I told my wife, I'm like, I only got 12 years left, so let's make the best of it, right? So
yeah, shoot. Yeah.
But yeah, so I mean, some of it's self-inflicted because ER docs tend to be sort of action junkies. Are they going cliff diving on the weekends?
That's what I always see. Not. Yeah.
They're riding their bike without a helmet. They're just being crazy. But I think some of that, obviously, unfortunately, is a very high rate of suicide. Mental health is huge.
Yeah,
And, we do see burnout. I mean, ER physicians definitely have one of the highest burnout rates. And part of it is just this sort of constant pressure of do more with less, increased documentation demands, increased demands from patients that just, they do wear on you. And we do care. Honestly, we do, but
of
it's just,
course.
it's hard. It's hard to take care of patients well in this environment now, and
Yeah,
it's actually getting worse. And I don't know if I'm just like the grumpy old man now that feels this way, or it
yeah,
actually is this way.
yeah.
So I think that's a big part of it too.
It's I always say, like, you're a human and you're working with humans. And so there's always
Yeah.
going to be, sometimes there's errors and there's things that maybe don't go the way that you would plan them to go, and that gets to you for sure, because I think you're probably much like me, where you're a bit of a control freak, because your whole life I'm sure you were, you start out being really good at school, and that's your identity, is being able to control your grades. This is where I'm coming from. um, always being at the top of the class, and then you start to work with other human beings. That control is not there anymore, and so that sometimes gets to be it too. So that can wear on you, definitely. And yeah, I mean, it's just, yeah, you get burnout. You get burnt out, because we're human and we experience that. But yeah, it's, I think, realizing and being grateful as much as you can to be able to help people, because honestly, if you think about it, Dr. Parente, the majority of our patients are wonderful and grateful. So yeah,
Yeah. And
yeah,
those are the moments I think that we live for, is,
yeah,
when I'm in the emergency room and somebody says, "Hey, do you have your own practice? I would like to be your patient." And you're like,
mhm,
"No, I really appreciate that. That's beautiful, but like, no, I'm just an ER doctor. Like, I'm just here for emergencies."
yeah,
But you like can make that connection, and that's nice. I feel like, unfortunately, those connections are not as frequent as they used to be, and part of it's just like nationally, like we're just getting squeezed, right? I mean, there's only so much you can do.
yeah,
See more patients, have less resources. Let's have less nurses. Let's have, nursing burnout is very real, nursing turnover. So it's just like this constant pressure of doing more with less. And I know I see this nationally in my side of healthcare. Is there anything going on nationally in dentistry? I know they just passed like a different budget bill and all this stuff that's like got people pretty freaked out.
yeah.
Is there anything nationally that's happening that's like putting the pressure on you guys too?
So, I mean, I think the biggest complaint most dentists have is gonna be like reimbursement from insurances, and I'm sure you probably know that too. As far as dental insurance goes, I don't think that, like, the average PPO dental plan has not increased their fees that they'll pay out for at least 15 years, and I mean, imagine the change in inflation. So it's
Right.
frustrating. And if it is a change, like a bump up, it's a couple dollars here and there. And I'm not trying to say, we're only in it for the money, but yeah, that gets pretty frustrating. And just the, dealing with insurances, I think that's the overall irritation, if you will, with the dental world. So that's really
Yeah,
it.
for sure. And
Mhm.
I just had my last episode. I had Dr. Glockenfleckum. I don't know if you follow
Yes,
him or not.
and I
And
saw your episode. Yeah, he's great.
uh,
I love that guy.
he's yeah,
Yeah.
he's fantastic. And we
Yeah.
talked we talked a lot about insurances, and unfortunately, some of these insurances. I don't know if you're following some of these stories. A lot of these docs are coming out and putting these like denial calls on social media, and
Yeah.
it's fascinating to watch. It's actually
Yeah.
terrifying as
I
well,
know. I know.
and they're actually retaliating. So like these
Yeah.
like insurance companies are now like making these like there's a surgeon, I forget her name, it's Dr. Potter, I think, and she's been very vocal, and they've like basically black boxed her now. So she's like she's considered out of network and all this stuff, and she's
They,
like fighting for her like surgical
yes.
life.
Yeah.
And
Yeah.
it's crazy the power that they have, and I don't know if that how much that impacts you in the dental world. For me in the ER, it doesn't really impact me because I'm gonna be there and people are gonna show up in droves all the time, no matter what happens.
Yeah.
But
Yeah. You get,
for all the
yeah.
impact on healthcare is real.
Yeah, for sure. And I mean, honestly, like, by and large, most of our procedures are elective, right? So, there's a very big difference there. It's pretty stark, as far as that goes. But yeah, I mean, certainly you can get sort of, a reputation, if you will, from insurances. Like, if they see, you know, trying to do a crown a dental crown that they, don't deem as necessary, and maybe they'll kind of look at your stuff a little closer, certainly. But as far as like patients realizing that they're not getting covered because of a certain dentist, I don't think I've ever experienced that myself. I mean, I'd like to say I just try to be as ethical as I possibly can, certainly. But
For
if I
sure.
see something needs to be done, I'm not gonna, try to squeeze around certain things just because insurance isn't going to pay for it, because they can't dictate our treatment, right? So it's just
Right.
always this ongoing battle. So
Yeah, for sure. And seemingly unending. And I honestly don't know the way out, to be honest, because it seems that nobody in Washington is very interested in like trying to fix this problem. We can't fix it on our own. And so we just all just keep playing within the rules of the game, and the
yeah,
game sucks for patients. Like if you're
yeah,
stuck in these situations,
because
you
ultimately
know,
they lose, right?
exactly.
Yeah, yeah,
Yeah.
it's
So
yeah.
I wanted to switch gears a little bit, and I never like to finish the show with something that's super negative, like us talking about insurances, which is really super negative.
Right,
But
right.
I love the content that you're putting out there. Like, how did you get into like creating content?
Well, I appreciate you saying that, honestly. And I think your stuff is great. One thing I will say, as far as my content, there's no specific niche. I would say I am the niche. There we go. I personally,
Some
I
self
use
branding. I
it.
love it.
Yeah, you know what? I just put out stuff like that just makes me laugh, and I feel like I try to be relatable. So it's not all dentistry for me. It was
For
for a
sure.
bit, but I mean, I got into it. I don't know if you know Dr. Slaughter. He's an ER doctor. He's out of Dallas. Um,
Yeah.
do you know
Yeah,
him?
he and I have
Okay,
talked a few times. I
okay,
actually think
okay.
I'm invited him on the show. Actually, I have a good
Yes.
idea I wanted to do with him on the show. Yeah.
I love that guy. I mean, so I kind of like I knew him from, he was on the Kid Craddock morning show, and like he was really friends with that radio show, so I kind of knew of him from the past. And then he ended up doing some sort of CE lecture where I was, and he mentioned TikTok, and I was like, oh, I thought that was only for like, kids dancing and doing silly stuff. But then I joined, and it became addicting, and then you start posting stuff and figuring things out and having fun. So for me, it's almost like a way of expressing myself and having fun, truly. But then also, if I do try to throw out some stuff that's dental related, it's truly for me not just educational like yours truly is, which is awesome. But for me, it's more I want people to see that like we're fun, and we like to have fun as dentists. We're humans, and we like to have a good time and just kind of joke around. And truly, I think going back to just something that's really rewarding for me as a dentist is most of the time I have patients that come in, and at the end of the procedure, or even after a couple of years, they're like, I was so scared to come see you, but you really made this easy and comfortable and fun. And I'm like, did you just say fun? Because yeah, that's good to hear. So that's, I
Yeah,
mean,
that's
yeah, that's kind of
but
why I jumped onto it.
well,
So
I think it's awesome. I think it's hilarious that you said that. I actually once in a while, this happened to me this week. I was in the ER and I was working, and I happened to like had like 5 minutes where I was waiting for labs to come back. So I had a little bit of a break in the action, and I opened up Instagram for whatever reason, and I saw that my last two follows here within the last few minutes were both patients in the ER.
oh shoot, you're like, oh,
I'm
you
like,
found
okay,
me.
yeah. I'm like, all right, well, there we go.
Yeah,
There it is. So,
that's awesome.
uh,
And I'm sure that they're like, honestly, because it's not just kids anymore that are on TikTok. And I'm sure if you had patients, they're
right.
like, this guy's freaking cool. And like your personality comes out, and it just makes people feel like, okay, yeah, I can feel like I can approach you now because you're normal and you're cool and fun. And yeah,
Yeah.
that's awesome.
Well, I think sometimes we get a little robotic in healthcare, and especially I have to see so many
Yes.
patients every shift. Like I'm like in, I'm out. I'm like nope,
Same.
no
Yeah.
monkey business. Like let's do this. And I do try to sit down and try to humanize myself, but I do think the social media helps to humanize us
Yeah.
in a certain way. So I
Yes,
think
for
it's
sure. I
it's
was just
fun.
telling my assistant this morning that some certain patients will show up, and it'll be this almost like cookie cutter um, thing to say to them. I'm like, well, just push play, right? Here we go. Just say the same things. I'm just looking straight at the patient, like play. Okay, I just got to go through my simulation here and let the program run, So, but yeah,
Yeah, for sure.
yeah,
Yeah, we get into that with some of the seasonality of what we do. Like when we get flu season, like I make the same speech like 27 times a shift. And it's
yep,
like, it's very,
yeah.
it can be exhausting, but
It
it is part of the
definitely,
job.
yeah, for sure. I
So,
know, I know.
yeah. So do you ever face like criticism from either patients or like other people that are just like on your social media? Because I face quite a bit, and like, oh, you're gaslighting and you guys don't care and you should have your license taken away, and you're like, holy cow, like I'm just having some fun with some videos online. Is this something that you've ever bumped into?
Yeah, I mean, especially if I go live, people are always like, "Oh, are patients waiting for you?" Like, no, no, they're not waiting for me. But yeah, there's certain topics that I try not to get into as well. Certain things like
Mhm.
fluoride or root canals. There's been stuff, controversial stuff that I just try not
Mhm.
to. And even if sometimes I'll get tagged in certain videos and criticized, and I just ignore it, honestly. And if it's something that somebody does want to discuss, I'm like, hey, I'm happy to discuss with somebody, just not like in front of the entire platform. So yeah, but I have for sure, yeah. And I mean, there's always going to be those people out there. So
Yeah, for sure. I just had a video that kind of went bananas last week where I really, honestly, I spent about 1 minute on the video. Like it wasn't produced or anything. It was just like me talking into a camera.
yeah,
And I was talking about like how patients can get their access to the results of their test before like I even have a chance to review it.
yeah,
And I think that's
sure,
problematic in the ER
yeah,
because what happens is a lot of patients will be like on their call bell, like, hey, the doctor needs to come in here and explain to me what this abnormality is on my CBC. And I'm like, well,
but
the other 9 labs aren't back yet. Like I can't physically run into
yeah,
every single room
yeah,
every time something comes back. Or this
right.
week I actually had somebody that had cancer diagnosis on a CT. And like that CT, if it was released to him before I even had a chance to go in, like that would be devastating. Like when I have a
Yeah,
devastating diagnosis, I sit down with the patient, I sit down with the
yes,
nurse, and
sure,
I make sure that I deliver it in the most respectful, informational way possible. And
right.
obviously, so by no means was I saying the patient should not have access to their records. Like,
Yeah.
and these comments on TikTok
Oh,
went bananas. And they're like, you're a jerk. Like you want, no way. This is my body. These are my labs. I need to know them right away because you guys miss this and you guys miss that. And you guys miss all this stuff.
wow.
I'm like, so I'm like trying to respond to all these. And then eventually
Yeah.
there were literally like 1,300 comments. I'm like, yeah, I'm not even going to
Oh,
do this.
Lord. Okay. Yeah. I
We're going to
mean, I
just ignore that.
guess, and I feel like, once the unfortunately the algorithm realizes, oh, this is a hot little video that the angry people will want to talk about. So you're getting all of the angry people that want to talk about exactly that to comment on it. So it probably feels a lot worse than it really, should have been. But yeah, I mean, I totally agree with you, obviously, but there's people that are not realize. I mean, if you're not in medicine, in specifically emergency medicine, how do you know how it runs and what these subtleties are that are important, like you're just mentioning? So,
Yeah,
I
I was
mean,
like, how do you juggle 23 patients? And
yeah,
then, at any given moment, there's a lab that's coming back on this one. There's a lab that's coming back on that one. There's an x-ray that just came back on that guy. And oh, by the way, I'm
right,
doing CPR on a 6-year-old over here. Like, I mean, like people don't understand like our jobs. That's okay. It's not their job. All they
exactly,
care about is why they're there. But it's just funny how you get some of this negative, light shed on you. And then all of a sudden these comment sections go out of control. And what's funny
yeah,
about this one is that I think obviously a lot of healthcare people follow me, and I think they were interjecting and saying, no, like you don't understand what he's saying. He's not
yeah,
saying don't do this
yeah.
all together. Like,
Yeah.
so it's just this big fight, and
Yeah, you're
it's
just
funny
kind of
when it
like grab
happens.
the popcorn, right?
I
Gosh.
know, right? Like
Yeah.
that popcorn eating meme, like just
Yeah, with the eyes,
totally,
yeah. Yeah. I it just
yeah.
it's that's how it is. It's like I will say, it goes with who are you if you have a heart condition, are you going to go see the dermatologist for it? Even as simple as that. It's you got to listen to the people that are the professionals in a certain field. Obviously, there was
Yeah.
one point in time where I'll be honest, I was going off on the way Peyton Manning was throwing the football at the end of his career. Me, you think I can comment on that? I can't even hold a
Hell
football.
yeah,
Look at
you
my
can.
hand.
You can probably make it real funny too.
Yeah, So that's sort of like go back to wait. Remember when you used to talk about Peyton Manning's capabilities at the end of his career, Diana? Yeah, let's hold the phone a little here. Think about that.
That's funny.
Yeah,
Yeah, it's funny.
right?
So if you, yeah, so I would not be doing my job if I didn't ask you about Shador Sanders because you're, obviously University of Colorado Buffalo. I'm a Cleveland Browns fan. Unfortunately, it's
Oh,
like my life's curse.
I know you're
Uh,
Ohio.
so what do you
I
think?
mean,
Is he going to be a good fit for the Browns? What do you
I
think?
I think so. I mean, obviously it's hard to say because certainly he's probably had a lot handed to him. I'm sure the talent's there, right? And it's genetically there. But I think he's got to be very disciplined, and unfortunately, I mean, I'm not going to criticize the Browns because look who I
They do
am.
plenty on their own.
But
Yeah.
yeah, they need good coaching, man. They need really good coaching, and I think for that discipline to be able to be successful, I think it's all in coaching in the NFL. I'll be honest. So we'll see. But it's been fun watching him for sure.
Yeah, I got a
He's a
chance to
buff.
watch him play, and he definitely has the talent. The
Oh,
question becomes it's the toughest position in all of sports. My son plays quarterback, and he's going into high
yeah,
school this year, and
yeah.
you got to have it between the ears. It's not just about having the physical ability. So be interesting. That's funny. I don't want to
Yeah.
be. I want to make sure I got your take after I saw that you went to the University of Colorado.
I know. Yeah,
Like you
big time.
got to have an opinion on that.
Yeah,
So
yeah, I did. I
all
was
right,
sad
so
to see
we're
him go so far in the draft, though. I kind of it was hard to see
yeah
that. It's always
yeah.
always tough, but
No, I don't think anyone saw that coming. I didn't think he
no.
was going to go in the first few picks, but I didn't think he
Yeah,
was going to go out in the fifth round.
fifth round. I know. It's like what? Okay, I mean, like we said,
Yeah,
like we were talking about, we're not in the business, so we don't
yeah,
know what the sitch is. But I think it was
yeah,
a personality thing, but I'm not sure 100%.
yeah, for sure.
Yeah,
Yeah. So I don't know. Maybe it'll end up being a good thing for him. Maybe it'll be like that humbling moment where
yeah,
he can use that as his chip on his shoulder and rise above. So
yeah. Totally.
we'll see.
Brady, like.
Yeah, exactly. God, that guy's awesome.
I know.
So I wanted to sort of finish things up. I wanted to do some rapid fire questions just to sort of like we talk about humanizing, and we both use a lot of humor in our content. So I wanted to
Yeah.
see if you would play a game with us and see what's your favorite food.
Uh, Pizza.
Yeah,
Pizza. Yeah,
yeah, I
with
could eat pizza
basil
every
and
day.
pepperoni. I mean, you can't go
Love
wrong.
it.
Can't go
All
wrong.
right, do you have a favorite drink or cocktail?
I don't really drink very much, but if I do, it's margarita.
Margarita.
Frozen
All right,
margarita. I had one in San Antonio. It was a peach frozen margarita. It was the
peach.
best I've ever had in my life. So I'm a little girly in that regard, but yeah,
I
if I'm
love
gonna
it.
drink, it's a marg.
I love it. Love it. I actually would love to see you put out content on tequila. I think that would be even.
Oh, it would have to be all deleted. It would probably get all community standards violation, everything.
Fair enough. What's your favorite vacation spot?
Hawaii. I'll say Hawaii's got, and I've seen you've been to Hawaii. I
Yeah.
love Hawaii, the most beautiful place to be. I will say, as I get older, the time it takes to get over there is a little tough, and the red eye going back to the States. I don't know if I can swing it anymore, so I've kind of converted to a Florida girl.
Okay. All right.
Yep,
I
yep,
like that.
yep.
I like both those places. I agree with you with Hawaii. When my wife and we try to go every 5 years, and I always say that I think going to Hawaii puts years on my life. It does because I'm just like so at peace and I'm happy.
Yes.
Just such a peaceful, happy place. But the
No.
flight then takes at least a year or two off my life on the
I
way
know
back. So,
exactly, and I hate to say it that way, but it's true. It's true. I can't deal.
but yeah, that's definitely something. My kids, I took them for the first time this year, and
I saw
usually after like day 5 or 6, the kids are
yeah,
like, we're ready to go,
yeah.
and I'm like, we're on day 11, and I'm like, do you guys want to stay one more day? And they were like, yes.
Oh,
But it
cool.
ended up not working out. But I was just
Okay.
like, yeah, you've done a good job as a parent when they're like on day 11 and they're like, oh, do we really have to
That's
leave tomorrow?
that's awesome. That's awesome. What island did you go to?
So we did half Maui and half Oahu. So it
Oh,
was
perfect.
a little bit of
Great.
both. And my last rotation in residency, I did a full month. I was actually there for about 6 weeks on
Was
Oahu. So
nice. Oh, I didn't realize that.
yeah, it was an
Nice.
elective, and yeah, it was incredible.
Yeah, perfect. Good for you.
So,
Yeah. Yeah.
last show that you binge watched.
Dexter. I
I
love Dexter. I've seen it like four times.
do you know I've never seen it.
It's so good. Okay. Do you know the premise? I'll just say it real
Yes.
fast. Okay.
Yeah, yeah.
Yeah. And then
I know.
there's
I
like
gotta watch it.
spin-offs. There's like spin-offs to it that are all good too. So you just he's so unique and it's such a unique plot and everything. It's just I love it. I love it. You get hooked. I also like
Good.
Breaking Bad.
Oh
These are
yeah.
old
That's
school shows, so I'm just,
yeah. We're
those are
going back through and trying to get some of the ones that we like missed that we never, like
yeah,
got into or whatever for whatever reason. Yeah,
yeah,
most of it was like subscription based because like everything's like a different subscription now.
I
Drives
know.
me
I know.
crazy.
Yeah,
So
there's so many
we're
different streaming services. I'm like, can I just like
exactly.
just one? It'd be nice to get all these shows, but I really want to watch Game of Thrones. I've never watched Game of Thrones. I heard
I've
that's
never seen a single
okay.
second of that.
No,
It's
everybody
crazy.
raves about it though, so I'm like, I guess. And
Yeah.
I always will watch a show when I'm on the treadmill in the morning. I'm kind of obsessed with running, so that's part of the keeping, fit and everything.
Right.
So in the mornings, if I'm on the treadmill, I literally will, go out of my mind crazy if I'm not watching a show. So that's where I watch my
Right.
Dexter. So
We just started binge watching White Lotus, which
I've
is
heard
fantastic.
is it okay? That might be the next
It
one.
is. Yeah, we just
Yeah.
watched season 1, but now I'm on to season 2, and it's like completely different cast of characters, so it's kind of
Oh,
interesting.
okay.
But
Yeah.
season 1 was incredible. It's a very unique show.
Okay.
Very unique. The cool thing is that it was filmed at Four Seasons Maui, which is where we spent our honeymoon. So
so lots of memories. Is it on
yeah,
Netflix or Hulu or
I
Paramount?
don't know what the heck. No, Cinemax, the HBO thing.
Oh, okay, got it.
Yeah, so I know you have to have
yeah.
so many different subscriptions.
That'll be my next one for sure. White Lotus.
There you go. And I'll check out Dexter because we gotta find another show to binge watch with my
I'm telling
wife.
you, I think you will like it. It's fantastic. Yeah.
Love
I
it.
think about it.
All right, we'll finish up with what's one thing that people don't know about you that you find either humorous or interesting.
Oh, wow. Gosh, that they think that they don't know that they think that I would think they would think is interesting. Gosh, that's a really good question. I can't even think right now.
She's like, this is way too deep for Thursday night at 6:00.
Right. I'm pretty hilarious. Like I'm pretty funny. I think I'm pretty funny. I mean, that's
I think you're
probably
funny.
I do. I'm pretty witty, and it's usually the humor is usually very inappropriate, but I guarantee
Love it.
that's kind of my goal whenever I hang out with people is I want to make them laugh really hard, and I generally make people do that.
I love it.
Okay, I wanted to be a stand-up comedian. That's truly that's where it is. That's the fact.
Okay. Yeah. That's the home run right there. Wow.
Yeah. So there's the fact. There's the answer to your question. Never made it, but yeah, that was always a dream of mine. So
Well, I think you're doing pretty well.
yeah, I hope so. I hope so.
Your stand-up comedy, kind of comes out in your personality on social media. So
yeah. I appreciate you saying that.
Yeah, for sure. Well, good. Well, I do appreciate you being on the show. Love chatting with you and love following you. We'll continue to follow.
Same.
To all the listeners out there, make sure you follow at DrMSmiles on social media. And you can follow me on Dr. J Parente, as you guys know. But yeah, it was great having you. And it was fun to talk about some of these dental things and where our worlds collide. So
loved it. I appreciate you, man. You have a good evening and good. You're working tomorrow? I understand. So you take
one
it
more
easy.
day and yeah, then I have the staycation with my kids. I got 7 days off with my kids. It's my favorite week of the year, and we just like spend time. We go on hikes. We do some cool stuff. So
perfect. You enjoy every minute of that.
All right. And as I finish every show, to all my listeners out there, peace, love, and happiness to everybody out there. Cheers, guys.